Michael is amazing. I met him actually when I first started. He actually was already here when I started back in August. He's a quiet, sweet little boy. You know, I just went in and bonded with him and would sit with him during his treatments, and we've been through a lot of things together. He was our first kid that got the Blincyto and everything, so we did a lot of adventures with him, and he's incredible. He's so strong, and he flew through treatment, and he was our perfect kid.
He went for a general endocrine appointment for routine blood work, and he was fine, no symptoms whatsoever, and they found his leukemia that way.
At first, they put me in surgery and took bone marrow to see how bad it was and stuff. And then they did my port and everything, and then once they found out how bad it was, they started chemo.
The reason he's very high risk is because of his age. So we know that kids that are younger do better with the types of chemotherapy. We give them chemotherapy for an entire month, and then we check them again, and we want their cancer to be completely gone. Michael's was not. His persisted despite chemotherapy. So we did 2 more months of chemotherapy and checked him again to see if he still had disease, and he still had disease. And so at that point we said, our chemotherapy is not working for you, and we know if we continue with it, you have a less chance to survive than if we try something differently. And so that's when we went to this new medicine called Blinatumomab. It was the only medicine that was able to get him into remission this far.
My job, you know, we are giving very toxic medications to kids, and so the hardest part about my job is watching kids experience the side effects of that chemo, and you know, pushing them through those things. And you know, sometimes we have to push kids to get things that they don't want or do things that they don't want, like get an NG tube to make sure that they get the nutrition that they need to be able to make it through therapy.
Every child with cancer or blood disorders should have an entire team working for them. We have a whole team consisting of a pharmacist that's dedicated specifically to hemonc, which is unbelievable. We have a child life team that helps kids like Michael if they're a little anxious when they're getting their needle sticks in their portacatheter, and they are unbelievable. We couldn't do our job without them. We have social workers that help with the daily ins and outs of the family. We have an amazing nursing staff here that they see these kids, like you said. They know the kids just as well as we do. They've been in the trenches with them. They've had their highs and lows with these patients. It's a whole team approach that not one person is bigger than another person. We have to work together, because if we don't, we might miss something that child could benefit from. Everybody from the top to the bottom who touches our patients, even from when they check in at the front desk, is important in our team.